Hi, welcome to AHA. I will spend just 10 minutes covering AHA with you and hope to accomplish three things. One, I hope to effectively define what AHA is and how it supports your workflow. Two, I hope to convey the discipline and rigor that went into developing AHA so that you can get a sense of the cognitive horsepower it delivers to your workflow. And three, I hope to clearly convey the value of AHA so that you can determine if it's a good fit for your organization, your goals, and your particular circumstance. Okay, on the title slide here, AHA is a deterministic reasoning algorithm that brings diagnostic horsepower to the clinical team when assessing, diagnosing, and treating patients. We like to call it algorithm in the loop of human reasoning. Let me say that again. AHA is a diagnostic reasoning algorithm that falls into your own clinical team's mental workflow when assessing, diagnosing, and treating patients. Plainly spoken, we like to think of AHA as a real-time medical advisory board that deliberates on your patient's objective data and plays naturally into your team's own mental process. Let's go to the next slide. There are a number of analytical activities that happen when your team is assessing and treating patients, and as they deploy their own mental model, AHA delivers precision insights in the following areas by ingesting and processing past and current labs. So you can see here that you've got your chief complaint, physical exam, history of illness, family history, social factors. AHA supports the red, lower left, providing a review of the systems at the organ level according to age, ethnicity, and gender. In the upper right, AHA plays a role when considering the possibilities of a differential diagnosis, and it supports the prioritization of that differential diagnosis to help determine which new labs need to be ordered if they do. AHA also analyzes and determines conclusions, which will fold into your team's own mental processing for consideration of optimal treatment plans, as well as post-treatment tracking for plan efficacy and optimization of outcomes. Now let's go into the algorithm itself. This clinical reasoning algorithm ingests many different types of labs. These include CBC, CMP, metabolic, lipoprotein, thyroid, nutrient. You can read the rest, all the way up to urinalysis. Now what you see here on the upper left and lower right, I'll start with the blue, is that upper left, we have a diverse medical advisory board that deliberates on the outputs of the algorithm each month going back 48 consecutive months or 4 years. The team is made of primary care cardiology, endocrinology, integrative medicine, functional medicine, doctors focused on women's health, men's health, elderly care, and the latest longevity research. They all come together and deliberate on any new findings to update the rules and performance of the algorithm. On the lower right in blue, all ingested labs on a monthly basis are utilized to maximize and optimize AHA outputs. On the lower left in green, you'll see that a foundation of the algorithm is global research. This is in relation to the lab markers, including any new monthly peer-reviewed research. The evidence-based data here is a foundation for the algorithm. The peer-reviewed global research is analyzed against, on the upper right, a retrospective set of complete charts going back 10 years. 30,000 retrospective charts where we analyze post-diagnosis, past labs, past and current outcomes, treatment plans, disease progression, disease improvements, and healing over time. These four elements, the team's deliberation, the global research lower left, ongoing lab ingestion lower right, and analysis of outputs, and 30,000 retrospective charts upper right interplay with one another to drive towards a more effective algorithm and set of valuable insights and outputs. These four elements result in two core drivers of the algorithm. At 9 o'clock in the orange, the algorithm delineates lab values and intervals using age, ethnicity, and gender from the research and charts to create a patient-specific set of unique intervals. In today's lab reports, as you know, we have normal, abnormal values, and we're having to eyeball how close those values are to the line in between. This is unnecessary cognitive load on your team and leaves open the opportunity to miss something. AHA provides more precise analysis of the intervals on the labs. Instead of abnormal and normal, we have a middle zone, which is really early disease stage progression, and something that can be identified quickly and easily with the AHA algorithm. At 3 o'clock in the orange, the algorithm delineates organ health based upon the level of stress, from healthy and good to stressed all the way to dysfunctional. And so the left and right together, the lab value intervals and organ health scoring, are a major component to the cognitive horsepower that AHA delivers to your team in a second. Note that we have originally drafted over 40 articles on individual biomarkers, approximately 10,000 words each, which captures the evidence-based approach to the algorithm via peer-reviewed research. This includes biological processes, pathology, physiology, mechanisms of action, the interplay between markers, and more. As we get into the math, there's continuous spectrum analysis, multivariate factor analysis, weighting and scoring, and root cause prioritization. There's over 7,000 rules built into the algorithm. What your team gets delivered is all of this cognition with 48 trailing months of continuous improvement, including new global research at the age, ethnicity, and gender level. The clinical team receives the outputs of the AHA algorithm at the time that they would typically receive standard labs. AHA is a far more powerful and supportive report for your team. Outputs include precision labeling of those lab intervals and organ stress scores that we discussed, with connections to the relevant lab values that drive those decisions. Number 2, focal point root cause summaries to get underneath the symptoms and prioritize the issues. Number 3, evaluation and management codes, ICD-10 and 11, that are appropriate and associated with the labs. And finally, custom lifestyle recommendations according to AHA insights for rest, diet, exercise, etc. Note that it is human nature to get siloed in our thinking, and AHA helps provide a foundational basis for analyzing the patients system-wide. And for primary care, AHA insights also support decision-making in terms of care coordination for the patient's overall optimal health. Upon ingesting standard labs that are in the patient's chart and/or new labs that you've ordered, here is an example of key insights that come from AHA. You'll see that AHA creates that middle zone in yellow, making it much easier to see what's problematic today and early stage, separate from early stage issues. You'll see in this second column that there's a list of organ health scores according to stress level. And on the upper right, you'll see that there's a summary. And in this case, the kidney, spleen, and liver are compromised, but that the focal point issues stem from the spleen. And there's dietary and hydration, exercise, and sleep recommendations for the patient based on their particular lab values. Next, we're showing here the ICD-10 and 11 codes that are related. Note that you can click on any of the elements in the report. For example, on the lab markers, you can see that there's descriptions of each marker, which is really helpful for PAs and even patients, which many of our clients share to engage the patient in their own health. Even for veteran MDs, having these clickable descriptions is helpful during analysis and problem solving. On the organ stress scoring, AHA also connects lab values with that particular organ health stress score to uncover the score's rationale. This covers my first two objectives with you, to convey what AHA is and the discipline and rigor that went into developing AHA so that you can get a sense of the cognitive horsepower delivered to your team's mental model of assessing and treating patients. Lastly, number 3, how do we think about AHA value so that you can assess relevance for your practice? On the last slide here, there's really 4 core benefits. 1, it delivers that cognitive horsepower. So what it really does is allow your team to work on top of this foundation when reasoning their way to an optimal assessment and treatment plan. Really, AHA analyzes the data and it separates signal from noise, which takes away unnecessary time and mental effort. The rigor that went into the foundation of the algorithm and the age, gender, ethnicity approach and the monthly committee deliberations provide a foundation of precision. Again, for your team to work on top of this when reasoning their way to optimal assessment and treatment planning. And fourth, AHA brings an element of repeatability to your clinical practice. For those with the goal of driving more standards or increasing precision, AHA is a wonderful foundation to support the clinical organization. Finally, AHA insights serve as evidence-based clinical documentation on objective patient data. This supports coding and billing teams when submitting claims, and it supports overall risk management for VBC, concierge, and other risk-based payer models. AHA runs on traditional patient labs, and they are available via your own AHA provider portal. We are offering free access to your own provider portal for using AHA on up to 100 of your own patients in an unlimited way in terms of all and any labs that you would like to run on each patient. Upon deciding to operationalize AHA into your practice, we offer an API so that the provider portal can fall away, and instead, AHA Insights will feed right into your EHR for efficiency and workflow. We look forward to discussing this with you further. Thank you.